The next individual coming up onto the stage is a physician from Dalhousie. And by the way, you all have, if you haven't had an opportunity to open these wonderful books, you have these books with photographs and bilingual biographies of all the individuals being inducted. I had to make a little change to the sequence today, but we're going to be calling up Dr. Jerry Warsh of the University of Toronto, who will be presenting to Dr. Roger McIntyre from Psychiatry, University of Toronto. Dr. Warsh.
So this is a real delight for me to be able to introduce the next inductee, someone who I've had the opportunity to follow in terms of their development as a member of the Department of Psychiatry, but this little fella who used to sit at the back of the room during psychiatry rounds and munch away and then ask these most piercing questions of the presenters. And I think what it was reflecting is his thirst for knowledge. So Roger McIntyre has distinguished himself over the years. I've had numerous occasions to be able to review his curriculum vitae in different venues. Roger is currently a full professor in the Department of Psychiatry, but also in the Department of Pharmacology and in the Institute of Medical Science. All of these departments are the same as I've had have been involved in for many years. Roger has developed a extensive program of psychopharmacological research in mood disorders. He's the head of the UHN Psychopharmacology Mood Disorders Clinic, and he's, in a relatively brief time, has taken that unit to a full international level, and Roger's extremely widely recognized for the productivity, the impact he's had in the field of bipolar research in particular. He has 248 publications that I was really surprised to see it had grown so quickly since I was sitting on the review committee for your appointment to the Department of Pharmacology. But given that rate of growth, I think he will turn out to be one of the highest publishing impact scientists, clinical scientists in Canada. He was recently acknowledged by the Thomson Reuters survey as one of the most highly cited clinical research publishing in the world. So that's quite a remarkable achievement at this stage. Numbers by themselves are not necessarily the most important indicators. Having been had the opportunity to review various pieces of work that Roger has done over the years, I've seen the quality. I'm a very critical eye when I review papers, such as for the Journal of Bipolar Disorder, and I have to say that Roger really has pushed the field in terms of novelty, innovation, and bringing to the realm of psychiatry, I think, a recognition for areas such as medical comorbidity that we find in our patients, and to begin to use some of those ideas to advance therapies. So without further comment, because I could go on for hours, Roger, would you please come up?
Thank you very much, Jerry, and those are very kind words, and I want to thank the organizers for this remarkable acknowledgement, and Mary McCallion, and congratulations to your wonderful career. What an inspiration. It was truly a humbling experience when Thomson Reuters had named me as one of the most impactful scientists in the world. As a psychiatrist and as a scientist, I had set off on this journey in Dartmouth, Nova Scotia, when I first came across someone who suffered from mood disorders. And at the time, intellectually malnourished as I was, hopefully a little less intellectually malnourished today, I was struck by the atrocious state of psychiatry in Nova Scotia, which extended into Canada, which extended globally. And it has been very much a personal calling for me to be in this space, and be in this space as forcefully and as impactfully as I have been. And it's been driven largely by the recognition that globally, we now know that 45% of the disability around the world now is directly due to a mental illness. And as the human capital economy continues, in fact, to be the speak, the relevance of brain-based illnesses will only, in fact, become more relevant, not just from an actuarial perspective, but from a quality of life and from a humanistic experience. And it's been that ubiquity, it's been that impact that has had such an impact on me personally, has driven the work that I have done. Mayor McCallion, without knowing it, you're also a leading neuroscientist. You had mentioned the word prevention. And psychiatry was the last of the subspecialties, the disciplines in medicine, to use the word prevention. And the work that we are doing and other groups around the world are doing collaboratively broadly aims to improve the quality of lives that people hope to experience who already have a declared illness. But I'd even say more importantly, to prevent mental illness. We want to prevent mental illness, and we can prevent mental illness, and we can cure mental illness. So our future in psychiatry is going to be about prevention. Our future is going to be about curing these horrible disorders, and it's going to be about finding very, very novel ways to treat those individuals who already have late stage or declared illness. I couldn't have done what I do without support, and I do believe that I am where I am. I've achieved what I've achieved because of the partnerships that I've had with many, many people in this room, and unfortunately many people couldn't be here today, who believed in me, they believed in what I had to say, and they gave me support, and I couldn't do it without them, in the public sector and in the private sector. I arrive at my office, my mind is going faster than I can keep up with. There's so many things I want to do. I've got a staff that somehow manages to stick around me. For the most part, my mood is stable, but my mind is quite disorganized. They help me bring it together, and they do in fact bring me not just a dose of reality, but a support, and their malleability is to be recognized, and so I thank them for what they do. My wife, in fact, tolerates the fact that I must smell like Air Canada all the time. She's fed up of using hotel soaps. She says, why don't you bring home a nice soap for me at one time, which I've endeavored to do recently, picked up her a nice bar of soap instead of a hotel soap. And so she has, in fact, been able to accommodate to my lifestyle and what I've decided to do very passionately, very dedicated, in a dedicated way. So I'll keep it brief. I know we got a lot on the agenda. Thanks, Jerry, for the comments. It's been a wonderful journey. The future in medicine will be about prevention, as Mayor McCallion has mentioned. In psychiatry, in fact, I hope is going to be a lead in that, and I'm very pleased to be part of that. Thank you very much.